As of April 14, 2021, only 23% of the U.S. has been fully vaccinated against COVID-19, so there's still a long road ahead. Experts say 50 or even 90% vaccination is when we'll reach herd immunity. Once it's your turn to get the shot, here are some things to keep in mind. 2 of the 3 vaccines authorized for emergency use by the FDA currently require 2 doses in order to be fully effective against COVID-19. And that second shot is very, very important, as infectious disease specialist Dr. Catherine O'Brien noted in a World Health Organization interview in January 2021. It's really the second dose that then boosts your immune response. The vaccines requiring a second dose are the Pfizer and the Moderna vaccines. The Johnson & Johnson vaccine is a 1-dose regimen.
The J&J is a single dose that will be massively helpful.
According to the CDC, if you receive the Pfizer vaccine, you should get your second shot 3 weeks or 21 days after your first. In regards to the Moderna vaccine, the CDC recommends you get your second shot 4 weeks after your first. With regard to both the Pfizer and the Moderna vaccines, the CDC recommends that you should get your second shot as close to the recommended 3-week or 4-week interval as possible. Nevertheless, there is a tiny bit of wiggle room. As of March 25, 2021, the CDC has clarified that you can receive your second dose up to 6 weeks after your first dose, if necessary. At your first vaccination appointment, you should receive a vaccination card. Do not throw it away, because it contains critical information you'll need going forward, including which vaccine you received, when you received it, and where. You will need that information for your second dose at the very least. In the event you're currently between doses and did not receive your vaccination card at your first appointment, you should contact the site where you received your first shot. You can also contact your state health department to get a card, because vaccination providers are required to report COVID-19 vaccinations to the state. If you received a vaccination card but have misplaced it, you should also contact your vaccination provider and, failing that, your state health department. If you have made every effort to locate your vaccination information, are unable to get a copy or replacement of your vaccination card, the CDC recommends speaking to your vaccination provider before going for your second dose. The CDC also recommends taking a photo of your vaccination card upon receiving it, and again upon receiving your second dose. This might not be what you wanted to hear, but we're not going to lie. Infectious disease experts are recommending that you continue wearing a face mask even after you're vaccinated. As Dr. Kristen Englund explains, until we have some level of herd immunity, the vaccine is now just another layer of protection against COVID-19. To get to the point where we can safely say we've reached herd immunity, at least 50% of the population will need to be fully vaccinated, and possibly as much as 90%. However, according to the CDC, you will be able to safely make certain adjustments to your mask-wearing routine after you get the COVID-19 vaccine. First and foremost, after you have been fully vaccinated, you can gather indoors with others without wearing a mask as long as everyone present has been fully vaccinated. And you can bring unvaccinated people from one other household into the gathering, as long as none are at increased risk for severe COVID-19 illness. After you get the COVID-19 vaccine, you will also still need to practice social distancing for the foreseeable future, according to the CDC. However, the rules have relaxed in certain limited ways, similar to the mask rules. Specifically, small private gatherings can now take place indoors without masks if everyone present has been fully vaccinated. Unvaccinated individuals from one other household can be included in such gatherings, as long as none are at an increased risk of severe illness or death from COVID-19. But please note, nothing else has changed. Even after you've been vaccinated, you should still avoid medium or large-sized gatherings, as well as crowded and poorly ventilated spaces. Additionally, you should continue maintaining 6 feet of distance from others when in public. The same holds true for private gatherings with unvaccinated people from more than one other household besides yours, and a mask should also be worn in that case. And, of course, you should maintain 6 feet of distance whenever in the presence of someone who is unvaccinated who is at increased risk for severe illness or death from COVID-19. Will these strict limitations with regard to travel finally relax for you after you get the COVID-19 vaccine? In a word, no. The CDC has left its no travel advice in place. Specifically, the CDC says you should still delay domestic and international travel, even if you have had the COVID-19 vaccine. If you decide that you cannot delay your travel plans, then the CDC still requires you to follow its existing requirements and recommendations. The CDC's current travel requirements include getting fully vaccinated if eligible, getting tested for COVID-19 between 1 and 3 days before traveling, wearing a mask when in public, avoiding crowds, and maintaining 6 feet of distance from those not in your travel group, getting tested 3 to 5 days after returning, and self-quarantining for 7 days, even if your test comes back negative. After you receive your COVID-19 vaccination, it is likely that your healthcare provider will advise you to not take any over-the-counter pain medication in the 24 hours following administration of your shot, according to Dr. Adam Brady, chair of the Samaritan Coronavirus Task Force. Certain pain relievers may inhibit the vaccine from doing its job by inhibiting the immune response. A study dated March 2021, published in the American Society for Microbiology's Journal of Virology, supports Dr. Brady's position, noting, "Our findings indicate that NSAID treatment such as Advil, Motrin, and aspirin may influence COVID-19 outcomes by dampening the inflammatory response and production of protective antibodies rather than modifying susceptibility to infection or viral replication. What your healthcare provider might not tell you specifically is you'll want to delay other vaccines you might be planning on getting for at least 2 weeks," as the CDC tweeted on March 11, 2021. If you get a COVID-19 vaccine, wait at least 14 days before getting any other vaccine. If you get another vaccine first, wait at least 14 days before getting your COVID-19 vaccine. Check out one of our newest videos right here. Plus, even more Health Digest videos about the latest hot topics are coming soon. Subscribe to our YouTube channel and hit the bell so you don't miss a single one.